My name is Kara Weatherman. I am a clinical professor of pharmacy practice at the Purdue University College of Pharmacy, and my specialty area is radiopharmaceuticals. So I'm also the director of the radiopharmaceutical programs at Purdue. Radiopharmaceuticals are a form of a drug product. What's different than what you traditionally think of from a pharmaceutical perspective is it includes a little bit of radioactive material. And so the idea with these drugs, we actually administer them to the patient. The drug product will move the material around the body, and then the radioactivity will give off radioactivity that can either be detected by an outside camera, or it can be used to actually treat disease in an area where that radiopharmaceutical will localize. So there's a wide variety of radiopharmaceuticals that are used that basically we can image just about every organ system in the body. But really, probably the biggest utilization of these drugs is in the cardiology realm, where we try to identify how much blood and blood flow is going to the heart. But we really are seeing a huge increase in the number of drugs and drug products that we have for various types of cancer. And so because we can use them both diagnostically, we can image the body and see where the cancer is. And then once we know where the cancer is, we know how much cancer is there, then we can come back and give that same drug product with a different radioactive material that will then go in, bind to the exact same spot, and then we use that radioactivity to kill off the cancer as well. Radiopharmaceuticals are extremely safe. We don't use large amounts of radioactive material, whether we're talking diagnostic or therapeutic. It's just enough for us to actually see what we want to see, and if we're going to treat the drug, it's going to sit there and we're going to give off radiation for an extended period of time, so we don't need a lot of it because we're doing it over and over and over and over again. So for most people, when we talk about the amount of radioactivity that you're going to be exposed to, a lot of people are exposed to more of it in their everyday life, whether it be, getting on an airplane and flying, or, if you live in a place that has a lot of radon, you might be exposed to radioactive materials. But we intentionally and very purposefully try to use the smallest amount of radioactive material to get the outcome that we're trying to get to at the end. So radiopharmacy is the pharmacy side of all of this imaging and treatment. And because we work with radioactive materials, our drugs do not stay around very long. So in a typical pharmaceutical manufacturing, we might make a drug and we can use it for 6 months, a year, 2 years, 3 years. Because radioactivity, by definition, goes away, our products, once we either make them or prepare them or whatever we have to do with them, they're going to be good for hours to days, maybe 2-3 days at the most. And so this has kind of created this whole area of radiopharmacy where we have to have somebody that's making these drugs and preparing them and getting them out to our customers on a day-to-day basis. So radiopharmacists who are involved in the preparation and dispensing, we're looking at a huge increase in the number of doses with these theranostic agents that we are seeing hitting in the market. So we will definitely need to have more and more trained folks in this space. You cannot handle radioactivity without going through very specialized training. And so a nuclear pharmacist or a radiopharmacist has that training, and you either get it from a place like Purdue, where we train you as part of your curriculum, or we can also do people coming back to a program and to get that training specific to radioactivity. As we watch the number of drugs that are in the pipeline and that are coming to market in the next few years, it's just going to continually increase the need for those pharmacists. In addition, though, we will see pharmacists are classically trained to do a lot of different things, not just dispense prescriptions. And so we see where pharmacists are going to be more involved in the regulatory aspects, in clinical trials, in looking at drug reactions, adverse drug reactions, and things like that. And so our classically trained pharmacists have a background that really can play a role in a lot of different areas, both pharmacy and manufacturing.